ಕಣಚೂರು ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ಇರುವಂತಹ ಒಂದು ಫೆಸಿಲಿಟಿಗಳಾಗಿರ್ಬೋದು, ಜೊತೆಗೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಚಿಕಿತ್ಸೆಗಳಿಗೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಟ್ರೀಟ್ಮೆಂಟ್ಗಳನ್ನು ನೀಡಲಾಗುತ್ತೆ ಅನ್ನೋದನ್ನು ನಮ್ಮ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದ ಮೂಲಕ ನಾವು ನಿಮಗೆ ತಿಳಿಸ್ಕೊಡ್ತಾ ಇದ್ದೇವೆ. ಇವತ್ತಿನ ನಮ್ಮ ಈ ಒಂದು ಸಂಚಿಕೆಯಲ್ಲಿ ಅಲರ್ಜಿ ಮತ್ತು COPD ಇದರ ಕುರಿತಾಗಿ ಮಾಹಿತಿಯನ್ನು ನೀಡೋದಕ್ಕೆ ನಮ್ಮ ಜೊತೆ ಇದ್ದಾರೆ. ಕಣಚೂರು ಹಾಸ್ಪಿಟಲ್ ಮತ್ತು ರಿಸರ್ಚ್ ಸೆಂಟರ್ನಲ್ಲಿ ರೆಸ್ಪಿರೇಟರಿ ಮೆಡಿಸಿನ್ ವಿಭಾಗದಲ್ಲಿ ಅಸೋಸಿಯೇಟ್ ಪ್ರೊಫೆಸರ್ ಆಗಿ ಕಾರ್ಯನಿರ್ವಹಿಸ್ತಾ ಇರುವಂತಹ ಡಾಕ್ಟರ್ ಫಿಲಿಪ್ಸ್ ಆಂಟನಿ ಅವರು ನಮ್ಮ ಜೊತೆ ಇದ್ದಾರೆ. ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆತ್ಮೀಯವಾದಂಥ ಸ್ವಾಗತ ಡಾಕ್ಟರ್.
ನಮಸ್ಕಾರ.
ಎಸ್, ಮೊದಲನೇದಾಗಿ ಈ ಒಂದು ರೆಸ್ಪಿರೇಟರಿ ಮೆಡಿಸಿನ್ ಅಂದರೆ ಏನು ಅಂತ ತಿಳಿಸ್ಕೊಡಿ. ನಿಮ್ಮ ಒಂದು ಕಾರ್ಯಕ್ಷೇತ್ರ ಇದೆ ಆಗಿರೋದ್ರಿಂದ ನಿಮ್ಮ ಒಂದು ಸ್ಪೆಷಲೈಸೇಷನ್ ಏನು ಅನ್ನೋದನ್ನು ತಿಳಿಸ್ಕೊಡಿ.
ಓಕೆ, we a team of doctors, myself, Dr. Krishna Prasad and Dr. Fasid work in a department of respiratory medicine. We are specialized in the lungs as in the airway, the lungs itself, the covering of the lung, the space of the chest wall and the space within itself. And basically we deal with all diseases including TB. Earlier days our department was called as TB and chest. So people have a feeling that respiratory doctors deal with only tuberculosis, but they actually deal with all diseases of the lung. Let's say tuberculosis, allergy, asthma, COPD, pneumonia, pus or fluid or air in the thorax, even cancers of the lung.
ಓಕೆ, ಅಂತ ಹೇಳಿದ್ರೆ ಈ ಒಂದು ಬೇರೆ ಬೇರೆ ಒಂದು ಅಲರ್ಜಿ ಮತ್ತು ಅಸ್ತಮಾಗೆ ಸಂಬಂಧಪಟ್ಟ ಹಾಗೆ ಈ ಒಂದು ಕಾರ್ಯಕ್ಷೇತ್ರದಲ್ಲಿ ನೀವು
Yes, allergy and asthma is the main problems that we face in the day to day life.
ಓಕೆ, ಹಾಗಾದರೆ ಮೊದಲನೇದಾಗಿ ಒಂದು ಅಲರ್ಜಿ ಬರೋದಕ್ಕೆ ಕಾರಣ ಏನು? ಅಲರ್ಜಿ ವಾಟ್ ಆರ್ ದ ಕಾಸಸ್ ಅಂತ ತಿಳಿಸ್ಕೊಡಿ ಒಂದು ಅಲರ್ಜಿ.
When people talk about allergy, let's say allergy is a big box. There are so many things inside that box. People say allergy as in they have irritation of the eyes, they have running nose, Sita, they have episodes of sneezing, and then some people have cough, some people have breathlessness, kemmo, dammo. They say that they are fillingness of the chest. Some people perceive it as kapha bartado doctor, kapha untu, kem untu, ana kapha bile baradilla. And these are the common symptoms of allergy, or as such we call them asthma.
ಓಕೆ, ಅಂತ ಹೇಳಿದ್ರೆ ಅಲರ್ಜಿ ಅಲ್ಲಿ ಬೇರೆ ಬೇರೆ ರೀತಿಯಾದಂಥ ವಿಧಗಳಿದೆ ಅಂತಲೇ ಹೇಳ್ಬೋದು. ಇವನ್ ಆಗಾಗ ಅಕ್ಷಿ ಬರುವಂಥದ್ದು, ಜೊತೆಗೆ ಏನು ಶೀತ ದಿನದಿಂದ ದಿನಕ್ಕೆ ಇರುವಂಥದ್ದು, ಹೊರಗಡೆ ಹೋದರೆ ಸಾಕು ಇವನ್ ಬೇರೆ ಬೇರೆ ವೆದರ್ಗಳಿಗೆ ಕೂಡ ಈ ಒಂದು ಶೀತ ಅನ್ನುವಂಥದ್ದು ಬರುತ್ತೆ ಅಂತಲೇ ಹೇಳ್ಬೋದು. ಓಕೆ, ಹಾಗಾದರೆ ಇದರ ಸಿಂಪ್ಟಮ್ಸ್ ಹೇಗಿರುತ್ತೆ ಈ ಒಂದು ಅಲರ್ಜಿ ಮತ್ತು ಅಸ್ತಮಾದ್ದು?
ಓಕೆ, different people have different symptoms to allergy. Different people have different causes for allergy. Now the most common thing that you see in allergy is irritation of the eye, redness of the eye, running eyes. You have watery
fluid.
Watery fluids coming from the nose. We call them Sita. Then you have episodes of sneezing. It's not like you have this every day of the day, every time of the day. At some point of the time, especially late evenings or early mornings, these things happen. You are having a very difficult time. Sometimes you miss work. Then you have cough. You are having severe episodes of cough, but very little sputum comes out. And then you have breathlessness even while sitting. You have a very noisy breathing, which we call wheezing. And even itching is a symptom of allergy.
ಓಕೆ, ಅಂತ ಹೇಳಿದ್ರೆ ಬೇರೆ ಬೇರೆ ರೀತಿಯಾದಂಥ ಸಿಂಪ್ಟಮ್ಸ್ಗಳು ಕಂಡುಬರುತ್ತೆ ಅಂತಲೇ ಹೇಳ್ಬೋದು. ಇವನ್ ಧೂಳಿಗೆ ಹೋದರೆ ಒಂದು ಫ್ಯಾಕ್ಟ್ರಿಗಳಲ್ಲೆಲ್ಲ ವರ್ಕ್ ಮಾಡೋರಿಗೆ ಇಚ್ಚಿಂಗ್ ಅನ್ನುವಂಥದ್ದು ಜಾಸ್ತಿ ಆಗೇ ಇರುತ್ತೆ ಅಂತ ಹೇಳ್ಬೋದು.
Definitely. People who work in factory, people who are exposed to smoke, pollutions of the outdoor pollution, indoor pollution. Outdoor pollution are the traffic police officers. Let's say people who are working in shops on the roadside. Any exposure to dust as in construction workers, people who work in mills, people who work in quarries, and even indoors. Let's say your environment is very polluted outdoors. Day to day our environmental pollution is increasing, and if you feel that closing the doors and windows and sitting inside your home makes you safe, it does not. Even if you clean your house, your floors daily, there are microparticles in the air that will irritate your airways and create allergy. Let's say when you talk about indoors, women who use chula or olate for cooking, women who sit at home roll beedis, for that tobacco dust is there. While cleaning, the cobwebs. Basically, when it comes to children especially, if there is dampness in the indoor area, fungus on the walls, your walls might look very clean, but if you look very closely, you will find very small dark spots, green spots underneath the sink. Basically, it is mold and fungi. There are very small particles that is particulated in the air, which is difficult to see. You can't see them, but you are breathing them.
ಎಸ್, ಈ ಒಂದು ಅಲರ್ಜಿ ಅನ್ನುವಂಥದ್ದು ಬೇರೆ ಬೇರೆ ಈ ಟೈಪಲ್ಲಿ ಕೂಡ ಬರ್ಬೋದು ಅಂತ ಹೇಳಿದ್ರು. ಇವನ್ನ ಹೊರಗಡೆ ಕೇವಲ ಒಂದು ಟ್ರಾಫಿಕ್ ಕೆಲಸ ಮಾಡೋರು ಆಗಿರ್ಬೋದು, ಅಥವಾ ಈ ಒಂದು ಫ್ಯಾಕ್ಟ್ರಿಗಳಲ್ಲಿ ಕೆಲಸ ಮಾಡೋರಾಗಿರ್ಬೋದು, ಅವ್ರಿಗೆ ಮಾತ್ರ ಅಲ್ಲದೆ ಮನೆ ಒಳಗೆ ಏನು ಕಿಟಕಿ ಬಾಗಿಲು ಹಾಕೊಂಡಿದ್ದವರಿಗೆ ಕೂಡ ಈ ಒಂದು ಅಲರ್ಜಿ ಬರುವಂಥ ಚಾನ್ಸಸ್ಗಳು ಇದೆ ಅನ್ನೋದನ್ನು ನಾವು ತಿಳ್ಕೊಂಡು ಬಂದ್ವಿ. ಎಸ್, ವಾಟ್ ಇಸ್ ದ ಓಲ್ಡ್ ಏಜ್ ಆಫ್ ಅಸ್ತಮಾ?
Old age asthma. Asthma has many phenotypes. We call phenotypes. Basically, you can say that there are various types of asthma. Let's say, for example, somebody who's anxious or stressed can have breathlessness and wheezing. You won't believe it. There is no need for allergy. Somebody who is having gas trouble, who is having regurgitation, can have cough and allergy like symptoms. Similarly, even though you expect it for the asthma problems to be in children, women usually have it in adulthood, during or later after pregnancy or delivery. And even men who don't smoke, who are very fit in their life, who don't have any habits or exposure to any particles, they have onset of symptoms at the later stage of life. We usually blame them that you have been smoking or something like that, but good people, their immune system starts overreacting when they are old. That is old age asthma.
ಓಕೆ, ಈ ಒಂದು ಅಸ್ತಮಾದಲ್ಲಿ ಕೂಡ ಈ ಒಂದು ಓಲ್ಡ್ ಏಜ್ ಅಸ್ತಮಾ ಅನ್ನುವಂಥದ್ದು ಕೂಡ ಕಂಡುಬರುತ್ತೆ. ಓಲ್ಡ್ ಏಜ್ ಅಸ್ತಮಾದಲ್ಲಿ ಏನು ತುಂಬ ಕೆಮ್ಮಾಗಿರ್ಬೋದು ಅಥವಾ ಇಚ್ಚಿಂಗ್ಸ್ ಆಗಿರ್ಬೋದು ಅನ್ನುವಂಥದ್ದು ಕೂಡ ಕಂಡುಬರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರು. ಇನ್ನು ಮಕ್ಕಳಲ್ಲಿ ಮತ್ತು ಮಹಿಳೆಯರಲ್ಲೂ ಕೂಡ ಈ ಒಂದು ಅಸ್ತಮಾ ಅನ್ನುವಂಥದ್ದು ಕಂಡುಬರುತ್ತೆ ಅಂತ ಈಗಾಗಲೇ ಹೇಳಿದರು. ಯಾವ ರೀತಿಯಾದಂಥ ಮಕ್ಕಳಲ್ಲಿ ಮತ್ತು ಮಹಿಳೆಯರಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂಥ ಸಿಂಪ್ಟಮ್ಸ್ಗಳು ಕಂಡುಬರುತ್ತೆ ಅನ್ನೋದನ್ನು ತಿಳ್ಕೊಳ್ಳೋಣ. ಆದರೆ ಅದಕ್ಕಿಂತ ಮುಂಚೆ ಶಾರ್ಟ್ ಬ್ರೇಕ್. ಈ ಒಂದು ಅಲರ್ಜಿ ಅನ್ನುವಂಥದ್ದು ಹೇಗೆ ಕಂಡುಬರುತ್ತೆ, ಜೊತೆಗೆ ಯಾವ್ಯಾವ ರೀತಿಯಾದಂಥ ಅಲರ್ಜಿಗಳು ಕಂಡುಬರುತ್ತೆ ಅನ್ನೋದನ್ನು ತಿಳ್ಕೊಳ್ತಾ ಇದ್ವಿ. ಇವಾಗ ಏನು ಓಲ್ಡ್ ಏಜ್ ಅಸ್ತಮಾ ಅಂದರೆ ಏನು, ಹೇಗಿರುತ್ತೆ ಅನ್ನೋದನ್ನು ತಿಳ್ಕೊಂಡ್ವಿ. ಈ ಒಂದು ಓಲ್ಡ್ ಏಜ್ ಅಸ್ತಮದ ಬಗ್ಗೆ ನೀವು ಹೇಳ್ತಾ ಚಿಲ್ಡ್ರನ್ಸ್ ಮತ್ತು ಈ ಒಂದು ವಿಮೆನ್ಸಲ್ಲಿ ಕೂಡ ಒಂದು ಅಸ್ತಮಾ ಅನ್ನುವಂಥದ್ದು ಕಂಡುಬರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರಿ. ಅವರ ಒಂದು ಸಿಂಟಮ್ಸ್ ಹೇಗಿರುತ್ತೆ?
Right. When you talk about children, you talk about children below the age of 5 years, after 5 years, and then we can talk about women. When you talk about small children under the age of 5 years, diagnosis of asthma is an diagnosis of mainly exclusion, because children, they cannot talk to you, they will sneeze, they will rub their eyes, they will have noisy breathing, they will have rhinitis. So usually us respiratory physicians take the help of a pediatrician. At Kanachur Institute of Medical Sciences, we have all specialization of doctors. We have pediatrician, we have the ENT doctors, we even have a cardiothoracic surgeon, we have a specialist doctor who's only managing the ICUs. So when such things come, first we take the help of a pediatrician, and then when the pediatrician has excluded all the diseases, then we step in and manage the allergy. When the child has grown up, he can talk, we can do a PFT. PFT is a test where we assess for the function of the lung. We can do a PFT, then we diagnose, and it is quite easy to treat. The problem with the treatment of children is use of what inhalers to use. What is the right inhalers to use? It is always a subjective thing. We will talk about it when we come to the treatment of it. Women, when you talk about women, if they don't have such problems in childhood, women usually, they don't talk about their problems. Usually, they deal with it. They adjust to life. But they will have some sort of symptoms during their childhood let's say episodes of sneezing or rhinitis, which might disappear in time only to reappear later when they are pregnant or after they have delivered a child, or if they are pretty much having a normal childhood. Most women, they do the job of bead rolling and then arecanut farming. The arecanut dust, the tobacco dust from bead rolling can also cause this disease.
ಓಕೆ ಅಂತ ಹೇಳಿದ್ರೆ ಮಕ್ಕಳಲ್ಲೂ ಕೂಡ ಈ ಒಂದು ಏನು ಹೊರಗಡೆ ಆಟ ಆಡೋದ್ರಿಂದ ಆಗಿರ್ಬೋದು ಅಥವಾ ಈ ಒಂದು ಸಣ್ಣ ಮಕ್ಕಳಲ್ಲೂ ಕೂಡ ಈ ಒಂದು ಅಸ್ತಮಾ ಅನ್ನುವಂಥದ್ದು ಕಂಡು ಬರುತ್ತೆ. ಜೊತೆಗೆ ಮಹಿಳೆಯರಲ್ಲಿ ನಾವು ನೋಡೋದಾದ್ರೆ ಇವನ್ ಬೀಡಿ ಕಟ್ಟುವಂತಹ ಮಹಿಳೆಯರಲ್ಲಾಗಿರ್ಬೋದು ಅಥವಾ ಅಡಕೆಯ ಒಂದು ಕೆಲಸಗಳಲ್ಲಿ ತೊಡಗಿರುವಂತಹ ಮಹಿಳೆಯರಲ್ಲೂ ಕೂಡ ಈ ಒಂದು ಸಮಸ್ಯೆ ಅನ್ನುವಂಥದ್ದು ಕಂಡು ಬರುತ್ತೆ ಅಂತ ತಿಳ್ಕೊಂಡು ಬಂದ್ವಿ. ಎಸ್ ಡಾಕ್ಟರ್, ಇದಕ್ಕೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆ?
Okay. When you talk about treatment of asthma and allergy, first you have to see whether your diagnosis is right. To confirm the diagnosis, we run a couple of tests. So the very first thing we do for an asthma patient is an X-ray.
Okay.
For an asthma patient, X-ray is expected to be normal. The next thing we do is a test called the pulmonary function test. Pulmonary function test, spirometry, is done to assess the strength or capacity of your lung. For an asthmatic patient, even if you don't have any problems right now, your lung function will be reduced. The strength of the lungs will be reduced, and this will be shown in the lung function test. Okay, so we do this lung function test to assess the current situation and then decide on what is the best treatment to go forward.
Okay.
And this pulmonary function test is also done to see how well you are responding to the treatment that we have given at some point of time. Now, when you talk about blood tests for allergy, blood test for allergy is done only to help us to decide on the line of treatment to give. Just because your blood test came normal doesn't mean that you don't have allergy or asthma. So what I am trying to say is there is no specific blood test for allergy, only to help us diagnose and decide on the line of treatment.
ಓಕೆ, ಇದಕ್ಕೆ ಕೂಡ ಬೇರೆ ಬೇರೆ ರೀತಿಯಾದಂಥ ಟೆಸ್ಟ್ಗಳು ಇರುವಂಥದ್ದು. ಓಕೆ, ಹಾಗಾದ್ರೆ ಆ ಟೆಸ್ಟ್ಗಳು ಯಾವುದು ಅಂತ ತಿಳಿಸ್ಕೊಡ್ಬೋದಾ? ಇದಕ್ಕೆ ಯಾವ್ಯಾವ ರೀತಿಯಾದಂಥ ಟೆಸ್ಟ್ಗಳಿದೆ ಅಂತ ಈ ಒಂದು ಅಸ್ತಮಗಳಲ್ಲಿ?
You are talking about the blood test or?
Yeah, blood test.
When we talk about blood test, the simplest thing we do is run a CBC, is a complete blood count. So when you do a CBC in asthmatics, you see whether the eosinophils are raised or the neutrophils are raised. So the treatment modalities change if you have an eosinophilic bronchial asthma, that is what we call when eosinophils are raised. But in the meantime, we also have to look about the other diseases who can cause an raised eosinophil levels. Okay, let's say if you have a helminthic infection, that worm infection, you can have eosinophilia. Even TB can raise eosinophilia. There are so many things that can cause eosinophilic disease. That is why I told you a blood test is not a diagnostic test for asthma. And the another thing that we can do is look at a total IgE. It will be raised. So if a total IgE is raised, our treatment modalities change. Just like eosinophil, total IgE can raised in many other diseases also. So just because blood test is not normal doesn't mean that you are having a very bad form of the disease, or just because your blood test is normal doesn't mean that you don't have a disease.
ಓಕೆ, ಒಂದು ಅಸ್ತಮ ಬಂದರೆ ಕೂಡ ಬೇರೆ ಬೇರೆ ರೀತಿಯಾದಂಥ ಬ್ಲಡ್ ಟೆಸ್ಟ್ಗಳನ್ನು ಮಾಡಿಕೊಳ್ಳೇಬೇಕು ಅಂತ ಹೇಳಿದ್ರಿ. ಓಕೆ, ಹಾಗಾದರೆ ಇದನ್ನ ತಡೆಗಟ್ಟೋದು ಹೇಗೆ? ಇದಕ್ಕೆ ಒಂದು ವ್ಯಾಕ್ಸಿನೇಷನ್ಸ್ ಆಗಿರ್ಬೋದು, ಪ್ರಿಕಾಷನ್ಸ್ ಆಗಿರ್ಬೋದು, ಏನಾದರೂ ಇರುತ್ತಲ್ವಾ?
Precautions. Okay, when we talk about precautions, let's say a certain person is allergic to something and another person will be allergic to something else. Some people will be allergic to a lot of things. Let's say allergy to dust. What we can do to avoid dust? You take precautionary measures like wearing a mask if you are doing work. If you are not having a mask available, at least use a wet cloth. If you are allergic to cold fluids, you can always avoid drinking cold fluids. Okay, if you are having allergy while you are on contact with cold water, let's say women at home while washing the dishes or washing the clothes, we can't tell them don't wash clothes or don't wash dishes. You use a kitchen rubber gloves. Okay, so what things cause difficulties difficulties to you, you take precautions to avoid those.
ಓಕೆ ಇದನ್ನು ಅಸ್ತಮಾ ಬಂದರೆ ಯಾವ ರೀತಿಯಾಗಿ ತಡೆಗಟ್ಟಬೇಕು ಅನ್ನೋದನ್ನು ಕೂಡ ತಿಳ್ಕೊಂಡು ಬಂದ್ವಿ. ಏನು ಬೇರೆ ಬೇರೆ ರೀತಿಯಾದಂತಹ ಇವನ್ನ ಮಾಸ್ಕ್ಗಳನ್ನ ಯೂಸ್ ಮಾಡುವಂಥದ್ದಾಗಿರ್ಬೋದು, ಅಥವಾ ಈ ಒಂದು ಕೋಲ್ಡ್ ವೆದರಲ್ಲಿ ಹೆಚ್ಚಾಗಿ ಒಂದು ಕೋಲ್ಡ್ ಡ್ರಿಂಕ್ಗಳನ್ನು ಸೇವನೆ ಮಾಡದೇ ಇರುವಂಥದ್ದಾಗಿರ್ಬೋದು, ಇದೆಲ್ಲದನ್ನು ಕೂಡ ಏನು ತಮಗೆ ತಾವೇ ಒಂದು ಅವಾಯ್ಡನ್ನು ಮಾಡ್ಕೊಳ್ತಾ ಬಂದರೆ ಈ ಒಂದು ಅಸ್ತಮಾ ಅನ್ನೋದನ್ನು ಕಡಿಮೆ ಮಾಡ್ಬೋದು ಅಂತ ತಿಳ್ಕೊಂಡು ಬಂದ್ವಿ. ಎಸ್ ಡಾಕ್ಟರ್, ಇನ್ನಷ್ಟು ಈ ಒಂದು ಮೆಡಿಕೇಷನ್ ಯಾವ ರೀತಿಯಾದಂಥ ಮೆಡಿಕೇಷನನ್ನು ಮಾಡಬೇಕು ಅನ್ನೋದನ್ನು ಕೂಡ ತಿಳ್ಕೊಳ್ತೀವಿ. ಆದರೆ ಅದಕ್ಕಿಂತ ಮುಂಚೆ ಸ್ಮಾಲ್ ಬ್ರೇಕ್. ವೀಕ್ಷಕರೇ, ಈ ಒಂದು ಅಸ್ತಮಾ ಅಂದರೆ ಏನು, ಅಲರ್ಜಿಯಲ್ಲಿ ಯಾವ್ಯಾವ ರೀತಿಯಾದಂತಹ ಅಲರ್ಜಿಗಳಿದೆ, ಇದಕ್ಕೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಟೆಸ್ಟ್ಗಳಿದೆ, ಅದರಲ್ಲೂ ಬ್ಲಡ್ ಟೆಸ್ಟನ್ನು ಯಾವ ರೀತಿಯಾದಂಥ ಟೆಸ್ಟ್ಗಳನ್ನು ನಾವು ಮಾಡಿಸ್ಕೊಳ್ಬೇಕು ಅನ್ನೋದನ್ನು ತಿಳ್ಕೊಂಡ್ವಿ. ಎಸ್ ಡಾಕ್ಟರ್, ಮುಂದೆ ನಾನು ಕೇಳೋದಾದರೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಒಂದು ಮೆಡಿಕೇಷನನ್ನು ಮಾಡ್ಕೋಬೋದು, ಯಾವ ರೀತಿಯಾದಂತಹ ಒಂದು ಮೆಡಿಕೇಷನ್ ಇದೆ ಇದರಲ್ಲಿ ಅಂತ?
When we talk about medication, we talked about diagnosis, we talked about prevention. Now coming to medication, I told you there are many symptoms, the many complaints that people have. So basically we can differentiate them into symptoms of rhinitis and kemmu and dammu. So when you have problem of itchy eyes, when you have problems of watery nose, when you have problems of sneezing, the basic treatment will involve tablets and nasal sprays, right? So but when you have a full blown asthma, if you are a full blown asthmatic, where you have dammu, kemmu, noisy breathing, the main line of treatment is using inhalers.
Okay.
Now there are various types of inhalers. There are powder, we call it DPIs, there are sprays, we call MDIs, and there are also a thing that we use in hospitals called nebulizers. Which inhaler device to use depends on person to person. Now if you say that you want us to treat asthma with tablets and syrups, won't be the right thing to do, because tablets and syrups are there for the treatment of asthma, but they are mainly supportive medication, not the main line of treatment.
ಓಕೆ, ನೀವು ಇವಾಗ ಹೇಳಿದ್ರಿ ಇನ್ಹೇಲ್ ಅನ್ನುವಂಥದ್ದನ್ನು ಬೇರೆ ಬೇರೆ ರೀತಿಯಾದಂಥ ಇನ್ಹೇಲ್ಸ್ಗಳು ಇದೆ. ಆದರೆ ಈ ಒಂದು ಇನ್ಹೇಲಿಗೆ ಅಡಿಕ್ಟ್ ಆಗಿಬಿಟ್ರೆ ಇದರಿಂದ ಹೊರಗೆ ಬರೋದಕ್ಕೆ ಸಾಧ್ಯ ಇಲ್ವಾ, ಅಥವಾ ಈ ಒಂದು ಅಸ್ತಮಕ್ಕೆ ಬೇರೆ ರೀತಿಯಾದಂಥ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ಗಳಿಲ್ವಾ? ಒಂದು ಇನ್ಹೇಲಿಗೆ ಅಡಿಕ್ಷನ್ ಆದರೆ ಇದರ ಪರಿಣಾಮ ಯಾವ ರೀತಿ ಬೀರ್ಬೋದು ಆ ಒಂದು ಪೇಷಂಟ್ ಮೇಲೆ ಅಂತ?
ಓಕೆ, ದಿಸ್ ಇಸ್ ಅ ವೆರಿ ಗುಡ್ ಕ್ವಶನ್. ಐ ಗೆಟ್ ದಿಸ್ ಕ್ವಶನ್ ಆಲ್ಮೋಸ್ಟ್ 10 to 12 times a day, and this is a common stigma or belief among people in this area, and not only this area, entire India actually. So what happens is people think that when you use the inhaler you feel better. When you stop using the inhaler, the disease comes back or the problem comes back. So naturally it is human tendency to blame the inhaler, right? Now you ask me, do I have to take the inhaler, isn't tablets and syrups enough? Now to explain this in a proper way, let's talk about tablets. You take a tablet. Now it can be 10 milligram, 100 milligram, 200 milligram, or if it is a simple drug like cetirizine, 5 milligram. Now you are taking that tablet, it is going into your stomach, it is metabolized, meaning absorbed into your bloodstream.
Okay.
Now your blood is not only going to the lungs, your blood is going to your heart, your blood is going to your liver, your blood is going to your kidneys, your brain, and blood is also coming to the lung. So a certain part of the tablet that you have taken is actually reaching the lung. There is effect there. Similarly there is effect everywhere else. The effect everywhere else is not the effect that we need. So we call it as side effect, and you need such a large dose for the medicine to do something that reaches the lung, right? It is similar with syrup. Now when you take an injection, you are directly putting medicine into your blood. Now I am not saying that taking tablets and injections or syrups are wrong. They are actually supportive medication. Now why do I tell that inhalers are the first line treatment. Now, I told you when you take a tablet or a syrup or an injection, it goes into the blood. Now, when you are using an inhaler, it is directly going into the lungs. It is directly reaching the place where we need the action to happen.
Okay.
Right? So, when we do something like that, the dosage of the medicine required is much lesser. Okay. So, instead of a 5 milligram or a 10 milligram or 100 milligram, what you are putting inside is in micrograms. That is 1 part of a milligram. Such a small dose. Plus, you are putting that medicine directly into the area that is required.
Okay.
Now, then to cause addiction, a particular substance, let's say addiction, when you say addiction, smoking addiction, alcohol addiction, drug addiction, all these things reach your brain.
Yes.
And to cause addiction.
Yes.
Now, when you put such a small dose in a local area, of it only 3% is getting absorbed to the bloodstream, there is no chance of addiction. Now why is it the disease coming back? When we stop inhaler, the action of the medication has stopped, and you have a disease that is treatable but not curable.
Okay.
Now that is the advantage of the inhaler.
ಓಕೆ ಅಂತ ಹೇಳಿದ್ರೆ ಇನ್ಹೇಲನ್ನ ಬಳಸುವಂತಹ ವ್ಯಕ್ತಿಗೆ ಏನೆಲ್ಲ ಒಂದು ಅಡ್ವಾಂಟೇಜಸ್ಗಳಿದೆ ಅನ್ನೋದನ್ನ ತಿಳಿಸ್ಕೊಟ್ರಿ. ಓಕೆ.
ವೆರಿ ಮಿನಿಮಲ್ ಡಿಸ್ಅಡ್ವಾಂಟೇಜಸ್, ಆಲ್ಮೋಸ್ಟ್ ನಾಟ್.
ಎಸ್. ಓಕೆ. ಹೇಳಿದ್ರೆ ಇದು ಕಂಪ್ಲೀಟ್ ಆಗಿ ಕ್ಯೂರ್ ಆಗಲ್ಲ ಅಸ್ತಮಾ ಅನ್ನುವಂಥದ್ದು. ಸೊ ಕ್ಯೂರ್ ಮಾಡುವಂತಹ ಮೆಡಿಸಿನ್ಸ್ಗಳು ಯಾವುದು ಬಂದಿಲ್ವಾ ಇದುವರೆಗೆ?
ಓಕೆ. ಟು ಟಾಕ್ ಅಬೌಟ್ ದಿಸ್, in late 1950s, one 13-year-old girl, I think her name was Mason, asked her father, after taking all sorts of medications, and she was still having problem breathing, father, don't you have anything like a medicine that you can put like in a perfume can and put directly into my lungs? So that father was apparently the president of a drug company, and that is how inhaler medication was discovered or invented. Now, when you ask whether the disease can be cured, my answer is asthma is a disease that cannot be cured 100%, but asthma is a disease that can be treated 100%.
Okay.
If you treat your asthma, you can be as normal as anybody else. You know, when you have all these problems, children are missing schools. Children are missing schools, adults are missing works. Old age people are not able to do what they want to do. Now, this is a significant problem for the workforce of our country.
Okay.
Now, since people don't use inhalers properly, their technique is wrong, they have problems or beliefs regarding this. They don't use their inhalers properly, hence they have recurrent problems. Now, asthma cannot be cured.
ಓಕೆ. ಅಂತ ಹೇಳಿದ್ರೆ ಇದನ್ನು ಕಂಪ್ಲೀಟ್ ಆಗಿ ಕ್ಯೂರ್ ಮಾಡುವಂತಹ ಯಾವುದೇ ಮೆಡಿಸಿನ್ಸ್ಗಳು ಇದುವರೆಗೂ ಕೂಡ ಬಂದಿಲ್ಲ ಅಂತಾನೆ
ಹೇಳ್ಬೋದು. Now, when it comes to children, certain children will suddenly become completely normal over time when people believe that they are cured, but at some point of time these symptoms reappear.
ಓಕೆ. ಎಸ್. ಅಂತ ಹೇಳಿದ್ರೆ ಈ ಒಂದು ಮಕ್ಕಳಲ್ಲಿ ಬಂದರೆ ಅದನ್ನು ಮುಂದೆ ಬರದೇ ಇರೋ ಹಾಗೆ ಸ್ವಲ್ಪ ಪ್ರಿಕಾಷನ್ ಮಾಡ್ಬೋದು ಅಂತ ಹೇಳ್ಬೋದು. ಓಕೆ. ಎಸ್ ಸರ್, ನೆಕ್ಸ್ಟ್ ಈ ಒಂದು COPD ಬಗ್ಗೆ ಬರೋದಾದರೆ, ವಾಟ್ ಇಸ್ ದ COPD?
ಓಕೆ. Now, when we talk about COPD, first thing I would like to say is, if you don't treat your asthma properly, it will become COPD.
Okay.
Now, COPD is chronic obstructive pulmonary disease. It is the world's third largest killer of people.
Okay.
Okay. Now, when you say COPD, in asthma you had breathlessness, dum untu, kem untu, episodic. It comes and it goes.
Okay.
But you have breathlessness all throughout. It starts as breathlessness while walking. Slowly, if you don't take treatment properly or avoid the cause, it increases, and finally you end up as a lung attack.
Okay.
So COPD is not only breathlessness also. It can be chemo, kafa bartudu, and ಕೆಮ್ಮು ಉಂಟು continuously, it lasts for 2 weeks, then it disappears. Again after 2 months it comes, but that is also a sign of COPD.
ಓಕೆ ಎಸ್, ಈ ಒಂದು ಅಸ್ತಮಾ ಮತ್ತು COPD ಕೂಡ ಬೇರೆ ಬೇರೆ ರೀತಿಯಾದಂಥ ಡಿಫ್ರೆನ್ಸ್ ಇದೆ ಅಂತಲೇ ಹೇಳ್ಬೋದು. ಎಸ್ ಡಾಕ್ಟ್ರೆ, ಒಂದು COPD ಅಂದರೆ ಏನು ಅನ್ನೋದನ್ನು ತಿಳಿಸ್ಕೊಟ್ರಿ. ನೆಕ್ಸ್ಟ್ ಇದರ ಕಾಸಸ್ ಹೇಗಿರುತ್ತೆ, ಜೊತೆಗೆ ಇದು ಯಾವ ರೀತಿಯಾದಂಥ ಟ್ರೀಟ್ಮೆಂಟ್ಸನ್ನು ನೀವು ಕೊಡ್ಬೋದು ಅಂತ ತಿಳಿಸ್ಕೊಡಿ.
Causes for COPD are many. Most of them are easily avoidable, but COPD as a disease is not completely curable. Now when you talk about causes, the most common cause for COPD is smoking.
Okay.
Men smoking, women using chula for cooking. Now when I talk to you, I will not ask whether you use chula for cooking, because you already have. Yes, but when it comes to old age women, they are already exposed to years and years of using chula for cooking.
Yes.
Now like I said, these beedi rolling women, Arakanat people, construction workers, mill workers, they are exposed to these things for years, and initially when they had occasional breathing problems, now becomes continuous. So all these things will lead to COPD.
ಓಕೆ, ಹಾಗಾದರೆ ಇದಕ್ಕೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಯಾವ ಥರ ಇದೆ?
Treatment. So I told you the most common cause of COPD for men is smoking. First thing to do is stop smoking.
Okay.
Now for certain people, stopping smoking is very difficult. Once they stop smoking, they will have very irritable behavior. They'll get angry easily. There are many psychological problems. So in that case, we can help them with certain medications.
Okay.
And continuously we have to counsel those people. We have to inform them the importance of stopping smoking. Again, treatment for COPD is inhalers, different types of inhalers, different medicines in inhalers. The medicines that we use in asthma is not the same as the medicines we use for COPD.
ಓಕೆ, ಅಂತ ಹೇಳಿದ್ರೆ ಈ ಒಂದು COPDಗೆ ಪೀಡಿಯನ್ನು ಅವರಾಗೆ ಅವರು ಕಡಿಮೆ ಮಾಡ್ಕೋಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ ಏನು ಸಿಗರೇಟ್ ಸೇದೋರು ಕಂಪ್ಲೀಟಾಗಿ ನಿಲ್ಲಿಸಲೇಬೇಕಾಗುತ್ತೆ. ಜೊತೆಗೆ ಈ ಒಂದು ಧೂಳಲ್ಲಿ ಕೆಲಸ ಮಾಡೋರಾಗಿರ್ಬೋದು, ಎಲ್ಲರೂ ಕೂಡ ಸ್ವಲ್ಪ ಪ್ರಿಕಾಷನನ್ನು ತಗೊಂಡ್ರೆ ಕಡಿಮೆ ಮಾಡ್ಬೋದು ಅಂತ ಹೇಳ್ಬೋದು. ಎಸ್ ಡಾಕ್ಟರ್, ಇಷ್ಟು ಹೊತ್ತು ನಮ್ಮ ಜೊತೆ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿದ್ದು ಈ ಒಂದು ಅಲರ್ಜಿ ಮತ್ತು ಅಸ್ತಮಾ ಹೇಗೆ ಬರುತ್ತೆ, ಅಸ್ತಮಾಕ್ಕೆ ಯಾವ್ಯಾವ ರೀತಿಯಾದಂಥ ಟೆಸ್ಟ್ಗಳಿದೆ, ಜೊತೆಗೆ COPD ಅಂದರೆ ಏನು ಎಲ್ಲದನ್ನು ಕೂಡ ತಿಳಿಸ್ಕೊಡೋದಕ್ಕಾಗಿ ನಿಮಗೆ ಧನ್ಯವಾದಗಳು.
ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
ಎಸ್ ವೀಕ್ಷಕರೇ, ಇಷ್ಟು ಹೊತ್ತು ನಮ್ಮ ಜೊತೆ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಡಾಕ್ಟರ್ ಫಿಲಿಪ್ಸ್ ಆಂಟನಿ ಅವರು ಒಂದು ಅಸ್ತಮಾ ಮತ್ತು COPD ಅಂದರೆ ಏನು, ಯಾವ್ಯಾವ ರೀತಿಯಾಗಿ ಒಂದು ಅಸ್ತಮಾ ಮತ್ತು COPD ಬರ್ತದೆ, ಇದಕ್ಕೆ ಯಾವ ರೀತಿಯಾದಂಥ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆ, ಇದೆಲ್ಲದನ್ನು ಕೂಡ ನಾವು ನಿಮ್ಮ ಮುಂದೆ ಇಟ್ಟಿದ್ದೀವಿ. ಇದು ಈ ಹೊತ್ತಿನ ವಿಶೇಷ ಸಂಚಿಕೆ ಅಂತ ಹೇಳ್ತಾ ಕಾರ್ಯಕ್ರಮವನ್ನು ಇಲ್ಲಿಗೆ ಮುಕ್ತಾಯಗೊಳಿಸ್ತಾ ಇದ್ದೀನಿ. ಮುಂದಿನ ಸಂಚಿಕೆಯಲ್ಲಿ ಮತ್ತಷ್ಟು ಮಾಹಿತಿಯೊಂದಿಗೆ ನಿಮ್ಮ ಮುಂದೆ ಹಾಜರಾಗಿರ್ತೀನಿ. ಅಲ್ಲಿವರೆಗೂ ನಿರಂತರವಾಗಿ ನೋಡ್ತಾ ಇರಿ V4 News 24/7. ಇದು ಮುನ್ನುಡಿ ಮುನ್ನಡೆಗಾಗಿ.